Hi, I'm Dr. Chris Crowley, Chief Medical Officer at Empire Medical Training. We're going to be demonstrating our filler for nasolabial folds. So this is what we perform in our level 1 filler class, and many of you may do in your office, kind of as a final treatment in a multi-step plan. And so this patient, we've already performed our neurotoxin on, and now we're going to be performing filler for nasolabial folds. I'm also going to put a tiny bit, as long as she's here. She has a little bit of a ripple here in her cheek that she's had filled before, but we're going to just put a small amount. This is a Refine, Rustler Refine is what we're using today. We're choosing this product because it's very flexible, it's low G prime, so it's perfect for a young patient that needs very minimal correction in these areas. Now for our nasolabial folds, we've already cleansed the area. We're well aware that kind of our riskier area is going to be the alar triangle. And so if we go and draw a line straight from the base of the nasal alon, and we border this laterally by the nasolabial fold, this area is our area of risk. And this is going to be where our angular artery, which is a branch of the facial artery, travels at a more superficial level. So when we're in this area, we need to be a little more cautious to avoid possible vascular occlusion. For our dermal fillers, this is going to be basically in the mid to deep dermis. So to make sure that we're in that level after we've cleansed the patient, we're going to measure the length of our needle, and where I see the end of the needle, that's where I'm going to make my entry site. 1, 2, 3, poke. I'm going to go in just at a depth that when I lift up the needle, I can see the outline of the needle, but I don't see any grayish discoloration whatsoever. If I see any gray, that means I'm too superficial. But with this depth where I can see the outline of the needle and no color, that is a perfect depth. I'm going to aspirate, and this is just gentle aspiration, just enough to kind of see if there's any blood in the tip of my needle or the hub of my needle for a good 6 seconds here. This is a pretty thin filler, so we'll see it relatively quickly if it was to be there. And then I'm going to apply pressure and inject slowly as I withdraw the needle. So this is called a retrograde linear thread. And so I'm injecting slowly as I withdraw. And then we will stop just prior to coming out of the skin. Now we can continue putting retrograde linear threads in this area until we get to the desired amount of correction, which is going to be all from our vision. So that first injection was about 0.05 milliliters of fluid. So aspirate again, aspirate before every injection. And this is again for a good 6 seconds, 8 seconds. The thicker the product, the longer you want to aspirate. And then we're going to inject slowly with even pressure as we withdraw our needle. Now, as we correct this, we're going to continue going all the way down this nasolabial fold. So the next injection needs to end basically where my first injection started. So I'm going to measure where I see this mark on the needle. That's where I'll make my entry point. Okay. If we go in, I'm going to aspirate just like I did in the first injection, and then inject as I withdraw. Now, if we want to put a second line of filler without sticking the patient again, we can do a fanning technique. So just before I withdraw the needle, I can redirect. And in this case, I'm going to go just medial. I will aspirate again. And now inject. Stop, finger off the plunger just before I exit. And I'll just continue working down the nasolabial fold until I have a visual correction, aspirating with each injection. Now you guys see we are using Pronox. Pronox is a delivery system for nitrous oxide. Nitrous oxide is a means of analgesia, and it also helps some with anxiety and helps the patient relax. Our model today is having several procedures done for us to demonstrate on camera for your guys' education and for your learning. And so we are using Pronox in the office because for us to do the video and teach it takes a little longer. But this is not necessary for you guys doing this in your practice, especially just nasolabial fold fillers. We don't typically use Pronox for that. But we do have it available. And if in your office, it's a great way to provide some anxiolysis if your patient needs it.